There's nothing that can be compared to the kind of nostalgia that Throwback Thursday provides for you. But today, I wish I could sit here and talk about nostalgia. But, like you should already know at this time, this is a time for our special radio series, an ending female genital mutilation in Edo State. And I'm so glad that you could join us this morning. Now, I have a guest who's going to be joining me on the show this morning. But if you've never been here before, let me give you a tiny bit of a preamble. My name is Joyce Chicks. This is your One Family, One radio station, Super 88.1 FM. Today's Thursday, the 4th of September 2025. And this is our special radio series on ending female genital mutilation in Edo State in particular and the world at large. Now, this is brought to you by the Women's Rights and Health Project with support from UNICEF Nigeria. Now, we've been able to touch different aspects of this conversation, ranging from the myths that exist, how harmful female genital mutilation is, or as you could know it, female circumcision. We've been able to speak to victims and survivors. We've been able to speak to young people and their move for advocacy to end female genital mutilation. We've spoken to the Ministry of Health, the Ministry of Justice, the Ministry of Women Affairs, and the conversation is still ongoing. But there's something that we must come to an understanding. Things like this, advocacy like this, needs one thing importantly, and that one thing is called funding. These types of conversations, these types of moves can only truly happen, can only truly make impact if the right funding is available for moves like this. So this morning, we are going to be looking at increasing funding support for female genital mutilation prevention and response as we move to end FGM in Edo State, Nigeria, and honestly, globally. Joining me this morning is Mr. Segun Babalola, who's a senior program officer with WRAHP. Good morning.
Yeah, good morning, Edo State indigents and Nigerians.
Very happy to have you on the show this morning. Yes, how are you doing? Are you doing okay?
Yes, I'm fine, thank you.
All right,
it's a pleasure to be here.
Amazing. So, without further ado, we're just going to jump right into it. Like I said, in the tiny bit of preamble that I made, funding is immensely important for things like this. I mean, imagine if we were at one corner of the street with a megaphone screaming "End female circumcision," we'll only be able to reach the people that are within that area. On radio, we are reaching millions. When we take these trips down to communities where we are doing this advocacy, we need money to get there. And so many other things that makes funding really important. But let me not speak like I am the professional. Let me speak to you. You work with WRAHP, and WRAHP has been doing this for a while. So how critical is funding to ending female genital mutilation?
Yes, thank you so much. Funding is very important for to address issues of FGM because there are a lot of things that is involved. You need the support, you need the funding support to drive advocacy, like you earlier mentioned. You need funding for training, building capacities of traditional leaders, gatekeepers who are, custodian of these traditions. And for you to change that narrative, for you to change the attitudes and behaviors, you need funding to put them together, maybe gathering in a hall, provide some light refreshment. And part of this work, you also need to provide materials, which we call behavioral change materials. Flyers, for example, banners, also coming on radio like we have done, like we are doing right now, also involves, some cost. You also need to bring some survivors sometimes, survivors who have, gone through this harm or this practice, and then you also need to provide medical support for some of them, economic empowerment for some who also need it. It's a lot of things that come together to make to address this FGM. So funding is very, very important, in making this change that we want in the community.
Now, I have to ask, I'm not going to sit here and assume that when we're talking about funding, I'm asking you how much is in your own account and how much are you putting into this advocacy. I know you're probably doing your own part, but the big question, and it's a question that many people think about when they hear about funding, where should funding come from? What is the scope of this funding? Who should be providing this funding?
Yes, thank you so much for this question. So it's a question that sometimes people are asking and thinking, okay, it should be from one source or it should be from this person or from this agency. Funding support should come from everyone. It should be everyone's business. When I mean everyone's business, the states, have a role to play. For example, providing an enabling environment for, people to come and support the work and address the issue. So, for example, government needs to be honest that this issue, are still there. So when when the government is open, then people can pump in money and say, okay, I want this issue addressed. We also have our donor partners, international agencies, the UNICEF of this world, the UNFPA of this world, the World Bank of this world. These are another source of funding that is very critical to addressing SGB. We also need to look at private sector. Yes, private sector may think, I'm not affected, but in the community you serve, these communities are that's where you are benefiting from. You are getting your income from. As part of your CSR, you can allocate some funds, to address the issue of FGM. Also, philanthropies. We have individuals who are well-to-do, who are also have this money and can also support the cause, because again, FGM, like we have been saying over the past 10 episodes, it's everyone's business. It's a human rights issue. It's also an economic issue, because if the women are affected and we are losing them to death or to illness and all that, they might not be able to contribute to the economy. So fundraising, raising funds and support for it to address FGM, it should be everyone's business. It should not be tied to maybe just government or NGOs like us, also trying to mop up funds from everywhere to see that these issues, are addressed in the society.
All right. Now, it sounds to me, or anybody else listening, that, this man has a solid plan on how to get funding, but still, clearly there are some challenges. So in your scope of work, especially with WRAHP, and maybe any other NGOs that you've been able to partner with so far, what are the kind of challenges that you have identified, whether it is in securing funding or receiving said funds?
Okay, thank you for that question. Like just mentioned, where I'm sitting as a member of WRAHP, one of the challenges that is out there that we are facing is the donors, most times are supporting these activities or this intervention on short-term basis. So there is insufficient, fund to deeply, to address this deep cultural practice. They come in, they give you money for 1 year, they give you money for 6 months, and all. But, if you look at that, it's just for short term. But sometimes we also, which is not enough to actually go into the community. Look at Edo State, for example. Look at the number of LGs. Look at the number of communities we have. Look at the distance, in this community between one community to the other. So the funding is insufficient to actually address some of these issues. Again, there are also challenges about institutional needs. For example, yes, as NGOs, we also need to support our staff. For example, support the office costs, rent, and all that. And some of these support do not necessarily address institutional needs. It's when the NGO is functioning that they can take on advocacy work, that they can take on policy intervention and all that, and also addressing service, providing services for people in the community. So some of these funds do not actually address the needs of the organization. They only give you money to do the project. So how do you cover for staff? How do you pay for the office? How do you eventually be able to get some even M&E, to monitor the intervention and see how far you have gone and the kind of progress you are making? Again, due to the we haven't CSOs, NGOs coming up every day. So let's assume we have 50 million pots of dollar of funds to address FGM in Nigeria, for example. In 2024, for example, we have less than 10 NGOs. In 2025, we already have less than 50 NGOs. So there's so much competition for limited funds, and then it's one of the challenges that we also face in this space. Again, sometimes there's lack of flexibility. Some funders, for example, whoever is supporting you is saying that I just want you to train TBAs, for example. But you as a practitioner, you understand that in that community, training the TBAs will not be enough. You probably need to support the survivors for them to come out and, get support that is needed. So sometimes there is this lack of flexibility, and, it ties you down to what you look at. For example, on these radio sessions, we have maybe limited episode. You might not be able to get, some flexibility to be able to say, okay, I want to make it 30, so that people will keep hearing the message every day. And from hearing, we say that's when change comes. So that's one of the challenges that we also face in NGO. Another issue that we also have is donor priorities. I think I also mentioned that slightly. So for what I mean here is that sometimes some funders are not interested in FGM issues. They are like, what? It's what we have seen over time. That's not an issue. Let's look at unemployment. Let's look at youth unemployment. Let's look at supporting agriculture, women farmers and all that. So it might not be a priority for some persons that might want to support the work you do. So those are some of the challenges that that we have in this we face in getting funds, for FGM intervention.
Wow, that's a lot to take in all at once, but I'm glad that you took out your time to spell it out. Sometimes when we speak about funding for different types of advocacy, somebody's in the corner thinking, oh, somebody wants to embezzle funds. So it's really important that we break it down and say, look at where these monies can go if and when we have them. Now, if you've just joined us, you're onto our special radio series on ending female genital mutilation in Edo State. It's brought to you by the Women's Right and Health Project with support from UNICEF Nigeria. And today we're looking at increasing funding for FGM advocacy. That's female genital mutilation, female circumcision, or the cut, whichever way you understand it. And if these words are still a bit bogus, essentially FGM is the removal of part or whole of the external part of the female genitalia. It could involve cutting parts of the clitoris or the entirety of the clitoris, and in some cases they go as far as closing up some parts of the woman's vagina, sewing it shut, only leaving a little hole where the urethra comes out so this woman can pee. Now, we've seen women have struggles with delivery. We've seen children, girls die from this procedure. We have some that have long-lasting illnesses, chronic infections. Some even go on to get things like HIV or hepatitis B because the materials used in this practice is not sterilized. So for an issue as big as this, an issue that is affecting over 230 million girls and women in the world, is something I think is big enough to get the required funding. Now, we've established the challenges that come with getting funding from this advocacy, but I like to be solution oriented. I don't like to be woe betide me. So is there a way that we can tackle these challenges? Do you have any ideas to put out there and say, oh, if we could do this, if international funders can do this, if private industries can do this, is there a way around these problems, Mr. Segun?
Yes, thank you so much. And I would like to write on what you mentioned earlier, which I think is even a good starting point. To address this issue, I think one thing that we need to do from where I'm sitting, as well as other NGOs or whoever is embarking on this journey of addressing FGM, is to invest in your financial system. Again, you mentioned the word accountability. People want to see where is my money going. Am I sure that my money is being put into the right, the right places? So, as NGOs, civil society organizations, we need to invest in our financial system, which involves, accountability, transparency, your proper reporting, invoicing, getting your necessary receipts receipts, your invoice and all that, so that whoever has supported you, be it international partners, philanthropists in Nigeria, CSR, private sector organization, you're able to justify to them to say, okay, this is where I put your money. This is evidence of my expenditures, to address FGM in the states or in the country at large. Now, also NGOs need to also invest in training, building capacity of their staff on proposal writing. That's if you are writing to private sector, you're writing to international partners, and also skills on fundraising. So fundraising, like it's usually being said, it's friend raising. Sometimes you might not need to write proposal. It's about meeting with people and pitching what you do. So if investment is made on staff on how to make friends with people and then try to bring them to align with the vision of the organization or the mission, and also the work that they do, it will also help, attract funding, and also help, achieve the mission of addressing FGM society. Also, I think also important for NGOs to also invest in communication and storytelling. If you tell your story in a compelling manner, people, because of that emotion, they want to put in, no matter how small the money may be. And sometimes when we're looking at funding, it might not be the big million of dollars. $1,000, for example, maybe people hearing us on this channel, for example, in the US, whenever they are tuning in, might be passionate with what we are saying, and like, oh, I have $500 I can just put into this work. I have $1 million, So storytelling, sharing your success stories is also very important. And again, monitoring and evaluation. Organizations like us, should continue to, invest in monitoring and evaluation, because when you monitor, you're able to show your results. You're able to, show your impact. How many persons have been reached? How many have been converted? I'm sure on this channel, on this station, for the over past 10 episodes, we've seen some people that have been converted. At least because we have been seeing feedbacks from people that call in to say, oh, I never knew this was this. So these are feedbacks, that can be tracked by the M&E person, for example, and then put it in a proper story, and then, share with friends, share with donors, private sector, and then, it helps to attract funding to the organization. I also think that it's also important for us to, keep partnering with other organizations, partner with other organizations who probably have more strength, in raising funds, and then you can bring in your expertise together, to help address the issue of FGM. And sometimes the partner you are working with may not even bring the cash. For example, if I don't have an office space and somebody is willing to give me an office space, it has not part of my problem. So, these are areas that that NGO, civil society organizations like us can, strengthen our capacity to attract funding and grants.
Amazing. Now, while you were speaking earlier, you mentioned CSR. So I want to jump on that particular thing. Me as a broadcaster, I always tell people that, I have my own CSR. What do I do as my CSR? I give free radio broadcast training to young to-be broadcasters. And we know that most standard organizations have things that they do as their CSR. But, these are private organizations. I'm looking at the partner that WRAHP has for this particular project, and I see UNICEF Nigeria. So if there are private companies or private brands who have been listening to us thus far, and they say, hey, I want to join in this, or maybe I'm a private individual, I want to be a donor partner. Is it something that the organization is open to as we move towards ending FGM?
Yes, very well. Thank you so much. I was still going to come to that. Yes, we are very open because, again, we want this message to keep, to keep coming up, to keep the discussion, we want to keep it going so that the behaviors and attitudes, people can change, especially when it comes to issues of FGM. So we are open to partnership, we are open to support from private organizations, individuals, can reach out to us, support us. Even if you're not giving us the money directly, this is Super FM. You can pay for the sessions, and we come on board, bring people on board that can come and and speak. So these are areas that we can part of partnership building that can also help keep the work going and then addressing the issues in the society.
And if I was a person who was listening and I would love to jump in on this, is there a way I could do that? Do I contact WRAHP directly? Do I have to go and search for UNICEF's phone number and send it to them instead? How do people who are interested to partner with you on this project, how do they contact you?
Yes, people can reach us on our website or on our email address, on our social media handles, any platform we are there. We're on LinkedIn, we're on Twitter, we're on X now. And on our social media platform, they can reach us and then, partner with us. And also on our website, there's a donation what's it called tab there where whatever you want to donate, you might want to be a frequent what's it called supporter of our work, maybe 10,000. We have people who are already doing that, every month. They are consistent with a specific amount of money. So no amount is too small. You can jump up on our website and then make this commitment to donate, maybe in kind or in cash.
Absolutely lovely. Now, as usual, we're going to open the phone lines and see if anybody had any thoughts, any questions, anything they want to bring up as we continue this conversation. Now, if you want to call us, the numbers are these: 0705 512 9881, 0705 572 7881, and this last number doubles for calls and for WhatsApp: 0902 672 2592. Hello, good morning. All right, do call us back. Hello, good morning.
Hello.
Hello, good morning.
Hello.
Yes.
Good morning.
Welcome. What is your name? Okay.
My name is Mama Obiasi.
Okay. Welcome. Where are you calling us from this morning?
Okay, I'm calling from Universal.
Okay.
Labo Street there.
Okay.
Medical area. So, I want to know, because I listened to your program yesterday, you mentioned section 29. But you did not mention, so I go through my this thing. I did not know.
Which program are you referring to? Sorry, which program are you referring to?
There's one, I think one.
Okay, so this show is specifically for female genital mutilation, so I may not be able to take this question now.
So how can I get this WRAHP?
Okay, the WRAHP law, right?
Not at this state, that's a net 2015.
If you're
National Assembly.
Oh, I'm not entirely sure what you're referring to because I did that show yesterday. But if you're looking for the WRAHP law, because I know that conversation was around abuse, if you're looking for the WRAHP law, if you type it VAPP law, Edo State, you would be able to get access to the entirety of it.
I have violence against persons.
Yes, that's the WRAHP law. Okay, so I need to get out because this show is for something else. So I want to dedicate their time to what it is for. So maybe you can call me back by 1 p.m.
I cannot read them. I cannot read these people.
This show that we are on, this circumcision show.
No, the people that can offer me this.
Okay, so I cannot use. Excuse me, I cannot use this show for this right now. Call me again by 1 p.m. and we'll be able to speak more clearly. Thank you so much. Hello, good morning.
Hello, good morning, George.
Good morning and welcome. What is your name and where are you calling us from, please?
Yeah, this is Maxwell on the car from Baka.
Happy to have you on the show. Community. Okay, go ahead.
Yes, you see, my concern about this is this. Genital mutilation, at the end of it all, we found out that this case, they are doing it with just no reason. And hello?
Yes, I can hear you. Please go ahead.
Yes, and as with no reasons, I say no reason why we are talking about funding the funds for this. If government really wants to do something about this, it's just a very simple matter. Put a law and not a law to this thing. Anybody found guilty.
No state has a law against FGM, actually.
Yes. Then what is delaying it? The people who are against these things, they can be arrested. It's for the people. The people we have. There's no need for phones.
There's no need for phones. Like Do you know that this radio show that you're listening to exists because of funding? The radio station exists because of funding. This radio station buys diesel. This radio station employs staff, not just staff who are on air. There are other staff who makes this radio station exist. My radio station. We have so many people in our employ. We have people in the newsroom, in the programs. We have people who are janitorial staff. We have security staff. We have the running cost. The way this radio station has this running cost, from what our guest has said, and please, Mr. Segun, stop me if I'm wrong, he has also explained the reason why there is a need for funding. But I will ask Mr. Segun to reiterate one more time for the sake of clarity.
Yes, okay, thank you so much. You've actually done some good work on responding to that question. So just to answer that, to add to what you have mentioned. So for him, listening and hearing this, it's funding. And then for police, who are the law enforcement, to arrest perpetrators, since there is a law, there is also need to support the funding to create that awareness for you, for example, or for me, to report this atrocity. So funding is needed, to create awareness for people to even know that it's an issue, that it's a harmful practice, and then report the case. And then for the survivors, there is also need to support them, either for treatment, either for empowerment, and all. The IC materials, that's the posters, flyers that you see around, addressing or talking about FGM, ending FGM, it's also being funded by somebody or supported by somebody. So these are some of the reasons why funding is also very important, in addressing FGM.
It's so important that we're having this conversation, because clearly, there's a bit of, it is misconstrued sometimes how things come to be. And if you're joined earlier, to my listener, if you're joined earlier when Mr. Segun started speaking, he even mentioned as much as just running the NGO, just the rent for the space that the NGO takes. And, just to make it clear, because I'm a broadcaster, this is a radio station, it takes a lot of money to even run the existence of a radio station. So if you think, it's on radio already, it takes a lot of money for the radio to even exist, for WRAHP to then partner with the radio to bring this to your forefront, and then all the other needs for funding. Hello, good morning.
Yeah, if you permit me to even add.
Okay, go ahead.
Okay, if you permit me to add. So when you mention government enacting the law, budget needs to be allocated. So they to even have police respond, because there has to be a budget line to say, okay, this is specifically for FGM prevention and response. So if there is need to to equip the hospitals, for example, that will treat these people, if we need to engage experts, maybe a counselor or whoever is going to address the mental state of survivors, for example, there has to be budget lines for this, even by the state government. So funding is very critical.
Anyways, our time is completely done. Thank you so much, Mr. Segun, for making all the time to have this conversation. I have a renewed hope that the funding that is needed for these types of conversations to continue. For the last couple of weeks that I've been having this conversation with my listeners, I've learned so much, and I cannot explain how important it is for these types of conversations to continue. We've been able to reach the right people. We've been able to speak to the right people, which means that if we continue to make these types of positive investments into ending female genital mutilation, we'll be able to win more hearts. And this scourge that is across our country and our state is something that we can hope that in a couple of years, if we're lucky, we can say this was in our past, because we stood behind WRAHP to end female genital mutilation in Edo State. Thank you so much for joining. Now, if you're a person who attacked WRAHP, you love the conversation we had today and you want to hear more about them, you can put a call to WRAHP on this number, 0701 194 8577 or 0913 520 5119, or find them across socials at WRAHP Nigeria. My name is Joyce Chooks. Thank you so much for joining us. Stick around. The switch continues from here on out.
The other stations, they try to be like us, but we are the super station.